Hi everyone, in this interview we're going to feature Meri Martinez, who is a biomedical engineer, and she's also the founder of the BME Life, a platform dedicated to educating and empowering the next generation of biomedical engineers.
Sounds good.
All right, so the first question I have for you is, can you just walk us through your journey from high school to where you are now, and how have you developed a passion for STEM over the years?
Yeah, so I think specifically like the medical field has definitely always been present in my family. My dad and my mom both graduated from medical school in Mexico. So that's definitely always been there. And I've always, heard them talk about when they have patients, just like trying to diagnose them or talking about medicine and surgeries and things like that. So I've always, especially even though my mom actually doesn't practice medicine, like she eventually decided to stay home and just take care of us and like me and my sisters. My dad is actually the one who, still works and goes to the hospital. He's an OBGYN, so he attends like to pregnant women, delivers babies and things like that. So it's always been fun to like listen to him and learn from him. um, so that's always been there. But I think in high school, like especially in senior year, we'd always take these tests to try to help you decide what you're good at. And it was interesting because whenever I took these tests, like my top results would always be art and science, and they would be like in like switch, like one test would have art first, the other test would have science first. So it was always like a mix of both, and I always thought it was pretty interesting. But I definitely agreed with it. I always really enjoyed math, especially math. Like I really really liked math, and then science was fun too. But yeah, I think I honestly probably would have been a math major, but when I started getting into calculus, like it just got too tricky for me. And I was like, I like math, but not enough to only do math. Like I want to incorporate some science into it. And that's how I decided to go into engineering. And then the biomedical really was just because I was interested in learning about how you could apply engineering to the biomedical world. So that's how I chose the field.
Yeah, so my second question for you is like, I know you talk more about more in depth about BME in your channel, but can you just give us a basic overview of BME? So what is BME and what are some career paths in this field?
Yeah, so it's interesting because someone actually once asked me, like, so what is biomedical? Like, is biomedical engineering, does that mean that you create babies? And I was like, what? What do you mean? And they said, like, yeah, bio, like babies, engineering, you're creating. And I was just like, no, like it was just funny, but like, no, like biomedical engineering really is what it sounds like, like using engineering principles to solve problems in medicine. So it could be um, like medical devices, pharmaceuticals, research, just like anything you could think of that really involves like medical technologies. So it's a multidisciplinary field because you do learn a little bit of everything. And we can touch on that later because I know one of the questions kind of asked a little bit more, um, where I could use that as an answer. But BME is definitely very multidisciplinary. Like you learn a little bit of everything: biology, engineering, a little chemistry. But overall, the goal really is to, use those engineering biology principles to create solutions to these medical problems. And there's definitely a lot of fields out there. I just mentioned, the medical device industry, which that's actually the industry where I'm in. And even within that medical device industry, there's like other branches. But apart from that, there's like pharmaceuticals. Then you start getting into the research fields that are more like neural engineering, tissue engineering, cell engineering, nanobiotechnology, things like that. So there's a lot, and BME definitely overlaps with other areas, like other similar STEM areas, such as like biotechnology. Bioengineering is very, very similar to biomedical engineering. Actually, most schools really use the terms interchangeably. So one may have a degree in BME and the other one might have it in bioengineering. They're both technically different, but a lot of people worry about it. Like they're like, oh, I really want to study BME, but my school only offers bioengineering. Just do it. It's like the same. Like schools treat it the same way, even though technically bioengineering is a little bit more broad.
That's awesome. And can you just talk more about what you do as a biomedical engineering engineer right now? So do you have like an example of a project that you're working on or a project that you have worked on that you would like to share?
Yeah, it's a little bit of a tricky question because right now, so when I graduated from biomedical engineering, I worked at a small startup company in the medical device industry. So what we were trying to do was develop this medical device that's like a negative pressure wound therapy technology. And what negative pressure therapy really means, it's really just like a vacuum, like negative pressure. And throughout the years, like they really found that negative pressure really helps in healing wounds. And this is because when you create that like pressure differential, like you stimulate the cells to move and work and do what they're supposed to. So people are starting to find how negative pressure can really help different parts of the body. There's a company right now that's really big on negative pressure, negative wound therapy pressure, and it's mostly for skin injuries. But I've seen companies use it in the brain. Um, my company specifically was looking to use it in orthopedic indications. So, using negative pressure to heal bone and things like that, specifically for things like spinal surgeries. So that was my first job, my first project as a official BME after graduating. But I recently got into like a super different field, which is like regulatory affairs. And regulatory affairs is kind of like you could see it as a mixture of biomedical engineering with a little bit of law and like ethics, because you like in regulatory affairs you really start working with the FDA, which is like the agency that regulates food, drugs, medical devices. um, and so they're a government agency, and when you're in regulatory affairs, you really look at what is the FDA requiring from medical devices, just so that we know that they're safe and effective, especially for new technologies. So I work as a regulatory affairs consultant right now, and I just started working, so I'm really new to this field. I'm no expert at all, but so yeah, you really just work with different small companies, like small medical device companies that they're bringing new technologies to the market. They want to sell them, and I think it's really cool because you get to help these new devices come to the market, and you hear about them before they're even sold. So I think that's really cool. Just to give a little bit of what kind of projects I work on. It could be anything from like a gauze, which is like super simple, like sutures, or like all the way to like AI technology that is just like software and detects some sort of disease with like thermal cameras and things like that. So there's like a really big range of projects, and I really like the field of regulatory affairs because it gives you that ability to look at different projects while you're working and not just one, which I mean either way would be completely fine, but I just really like that ability to learn about different medical devices. So yeah.
Yeah, that's definitely really cool because I mean, this field of like regulatory affairs just shows like how broad like biomedical engineering like the field
Yes.
is, and it's incredible like what kind of stuff you can see and interact with as a biomedical engineer. The next question I have for you is, in your opinion, what makes BME different from other fields? So why should or shouldn't a student pursue BME?
Yeah, I don't know if you've heard from your research that you've done in BME, but there's actually kind of a little bit of hate towards BME out there. And I think the main reason for that is because, like I mentioned earlier, like BME is such a multidisciplinary field. You learn a little bit of everything, and some people don't really like that. Like they're like, well, you graduate and you don't really have like a good in-depth understanding of like mechanics that a mechanical engineer would have, or you don't really know anything or much about electrical engineering, so just major in electrical engineering, or you don't know as much of biology as someone in biology would, because as a BME, it's still a 4-year degree and you're trying to learn all these things that other majors take like very specific classes, while we kind of take a little bit of everything that we can. So a lot of people don't like that, and that's totally okay. Like I think I could see why someone maybe would want to be more specialized and things like that. Um, but I personally liked it because I like that. I like the ability of learning different things. I like the ability of um, just having a wide variety of knowledge, not just engineering, not just biology, but being able to link the two. I think is really cool. Like if you have an engineer trying to communicate with a doctor, I feel like we're the gap between them, and it's like a very important role, and it's definitely something that's coming, to the world. Like BME is relatively new, but it's been created, I think, to fill in that gap, and I think more and more BMEs. I hope that BMEs will be more in demand, just because like technology is advancing, and with it we're creating new careers that are more specialized for those advancements in technology. um, but apart from that, I think BME is just really cool because you could choose to be an engineer for airspace, for the oil industry, which is cool. I mean, if you're interested in that. But I personally really like that BME, like at the end of the day, in BME you're actually helping like improve someone's life. And I think that's something not a lot of engineers can say. I mean, obviously everything helps like society as a whole, like airspace, you're helping like create, space exploration and things like that, which is really cool. I'm not gonna, deny that. But the truth about BME is that you help someone's health, their quality of life, and like you could save someone's life, maybe not directly, but you do it. And a doctor like makes surgery, and they help one patient at a time, but you working towards this medical device, this drug, um, at the end of the day, they're gonna help a bunch of people. So I think that's ultimately like something that's really cool about BME.
Yeah, it's definitely like a really unique perspective to look at it, like helping a lot of people at a time instead of just one patient at a time. And I also think that like the point you mentioned about being interdisciplinary is like really important, because I think that like research going forward is going to focus a lot on making like different connections between different fields. And I think, BME is like a great way to do that. The next question I have is, do you have any advice for students who are trying to find their passion within STEM?
Yeah, that's a great question because, I personally was like, when I started college, I was 2 years like undecided. Like, I didn't know what to study. I knew I was interested in like the STEM field, but I really didn't know what I wanted to do in it, like specifically. So I honestly think like what we are doing, like, you know, you interviewing different scientists and just like showcasing them, highlighting them, sharing their stories and what they do. What we're doing with our podcast, just having different BMEs like talk about what they do in different industries. I think that's the best way to really learn and like know what you want to do. I think when you look at someone and you're like, "Oh, I really like what they do and the path that they chose." And so you kind of choose them as your role model and you try to follow them and their steps. So I think for students, like, you know, social media is really popular now. It definitely wasn't like 20 years ago. You know, 20 years ago, someone couldn't look up, oh, like let me search BMEs like in a day in the life on YouTube. You know, like you couldn't do that, but now you can. Now there's a lot of videos. There definitely needs to be more, but there's definitely a lot of resources for people to find. Okay, like what's out there? What are people doing? And I think to me, that's the best way to really inspire yourself and like have a clear goal to look and like follow. So yeah, I think just finding resources like yours, like that's honestly my best advice to students.
That's awesome. Yeah. And I think that like since the pandemic, a lot of scientists has like opened social media accounts. And I think that's like
Wow.
looking at other scientists like day in a life has definitely gotten like a lot easier since the pandemic. And it's
Yeah.
awesome that these scientists are sharing like their journey and like their research and stuff like that. So let's talk a little bit about your YouTube channel. So I definitely love all the content on your YouTube channel. So what is the story behind your channel and your other social media platforms? And what do you hope to do through those platforms?
Yeah, so that's a great question. I kind of always, you know, been on YouTube, like just looking at other videos, and I always thought it was really cool. I mean, I feel like most people really enjoy YouTube as an entertaining platform. I originally honestly wanted to do like tutorials. Like that was my first idea. Like I was like, you know what? I kind of want to start making videos just for fun, doing tutorials. And I think a big push really was like my boyfriend. He's actually like r- always been really involved in like video and photography and content creating. So he definitely has a very strong background in that, and he always pushed me to like do a YouTube channel and like keep doing stuff in the channel. So I think one of our first videos was probably a tutorial, but then, you know, I realized that there wasn't a lot of resources for BMEs out there. Like I mentioned before, like BME was relatively new. And sure, you could Google like what is biomedical engineering and you'll get the cookie cutter answer, which is like, oh, you use biology and engineering to solve medical problems, you know, simple answer. But I think it's, you know, as someone who's a student, maybe you're in high school, maybe you're in college trying to decide what to do, I always, like I mentioned, I always think looking at people doing it always helps you just give you a better idea of what to expect. So I was like, you know what, like I'll just start talking about BME, like my journey. It was new to me. So I just wanted to share along, and I think the channel will definitely evolve with me. You know, in college, I definitely focused more in like, oh, what are you doing as a student and things like that. But now as I grow, I feel like I might start incorporating more of like the professional side of BME, but I definitely still want to tailor to like students because I think that's most important really, to really try to empower and encourage people to choose biomedical engineering, especially because, you know, I know that there's hate towards it, and I just want to let people know that it's not bad. It's a great degree. I personally loved it and have really enjoyed it. So I really just want to encourage people to choose BME. I think it's a great degree, and yeah, I honestly, if I could go back, like I would choose it again. Like I absolutely love it. So yeah, I just want to share that.
So the next question is, what have been some of your, biggest challenges? It can be, anywhere in your, like while you were a student, in life, career, anything like that. And how do you overcome it?
Yeah, so I think I mentioned earlier that well, I said my parents are in Mexico, but I more also originally from Mexico. So I came to the US while I was in high school, which I think was really helpful. Like it would have been worse if I had started in the US in college and like not done high school here. Um, but high school was definitely, I feel like, especially the first years, a struggle. Like, just having to learn like a different language and having that barrier was definitely difficult. Like, sometimes they would put videos with like no subtitles, and it was just so hard to even understand what they were saying. So that was definitely a struggle. So I really sympathize with people who come to the US straight into college not really knowing much English, because I thought I knew English, and then come to high school and like surprise, you don't. Like you really don't know until you live here, because it's not really until you live in the place that you really start learning the language. So that was definitely a struggle in high school. Then coming to college, I feel like the biggest struggle in the beginning was choosing a major. It was so tough to choose a major and really, be sure of what you want to do for the rest of your life. It seems like a very important decision. But like I said, it took me 2 years to decide. And I think the way the US school system does it, where you still have to take these general courses for like no matter what degree, whether you want to do music or engineering, like you still have to take English, history, government, things like that. So I think that's kind of smart in the way that it gives you time to decide if you need it. So I would tell people, like, if you're in high school and you don't know what to do and you're like really pressured about it, it's okay to take your time to make that decision, because it is an important decision, and we don't all know from when we're little what we want to do in life, and that's totally okay. It's okay to switch majors too. you know I'd rather do one more year in college than like graduate in something I don't want to do and then do that for the rest of my life. um, and then again, even if you do something in college, you can still switch your career path, kind of. So, for example, in BME, like you do BME as a degree, but when you graduate, your title is probably not going to be biomedical engineer. There's not a lot of like biomedical engineer titles. It's mostly like you're either in research and development, or you're in quality, or you're in product development. um, so you could also be a project manager, things like that. So I think that's also something to keep in mind. Just because you're choosing a degree, it doesn't mean you're like nailed to something that you can't move from. Like you can always evolve during your career. You can always do a master's in something else and specialize and get more knowledge to do something different. I don't know. So yeah, just making that decision was definitely hard. It took me like almost 2 years, but I eventually decided to go to BME. And honestly, I probably didn't choose it before because I didn't know about it. Like my school didn't offer BME because it was in a pretty small city. But then when I found about BME, I was like, I have to do that. Like I really like that, and I decided to move somewhere else. So yeah, and other than that, I mean, BME is a pretty tough degree. I'm not gonna lie. Like it's demanding. A lot of people ask like, oh, do you have time to party and socialize and things like that? I mean, you could if you wanted to, but if you really BME is not a degree that someone chooses because they don't know what to do. I feel like there's degrees in college that a lot of are kind of like people choose them, like a lot of people choose them because they don't know what to do. But BME is not something that just comes to the mind of someone that says like, I don't know what to do. I guess I'll just do BME. No, like BME is something that people that are really dedicated choose to do, because they know that any engineering degree is really demanding. Um, so BME is no different. It's definitely a hard degree. I think coming to a bigger city and going into engineering where I didn't really have any engineering background was definitely tough. In the beginning, I felt like everyone around me was so smart and that I didn't compare to them. Like I felt like they know so much and I know so little. But with time, I started realizing that they felt the same way. Like, I feel like we all feel like we're not smart enough. But I think with time, you will struggle in the beginning and you will keep struggling, but it gets better. Like, it does get better. In the beginning, I feel like you're still learning how to learning like how much time things take for you. So I think in every engineering degree, the beginning is hard. Like, but with time, I just don't give up because it does get better. I mean, your classes get harder, but you as a person just evolve and like your brain just gets better at understanding these concepts. So yeah, like the degree itself, it's definitely a struggle, but it's not hard and anyone can do it really. So that's
Yeah,
my
that's
answer.
definitely, really encouraging words for someone who's like looking at biomedical engineering, be like, that's too hard, can't do that. So, yeah,
You
and
can do it.
yeah, and imposter syndrome is definitely like a big thing for a lot of people too. And I know that, for myself, I'm like just starting a like virtual research internship right now, and it's definitely pretty intimidating. So, yeah,
Yes.
and like, cause I'm in like these lab meetings with PhD students, undergrad students, and like professors. I was like, yeah, so I can definitely relate.
Yeah, no, but I mean that's awesome that you're doing that, like you're still in high school and you're having those opportunities. Like those are really great opportunities and like experiences to have while you're in high school. Like I think I would have never thought of doing that. So that's awesome that you get to do that.
Thank you. Yeah. And one of the last questions is, what would be the number one tip you give to high school students aspiring to pursue a career in STEM? Now, I know you mentioned a lot of different advice throughout this video, but like, what would be your number one tip?
Yeah, I would say, you know, like I think we get a lot of questions in our channel like, oh, do you need math for engineering? Like, I'm not good at math, but I want to do BME, things like that. So first, like my first advice is if you really want to do it, you can do it. Um, Maybe if you're not good at math, you might struggle in the beginning. I mean, it's engineering at the end of the day. So you do use math, you do use science. So if you're good at those things, it definitely helps. But if you're not good at those things, you can still learn it. You can still practice and develop your brain to be able to understand those concepts. So my first advice is definitely like, don't discourage yourself without trying it first. Like you'll never know if you like something or if you can do something until you try it. And it's okay to realize that you don't like something, like especially when you're young. Like it's important to realize if you don't like something when you're young. So if you're in high school and you decide to go to a degree once you start, like I mentioned, you might struggle in the beginning, but give yourself a little bit of time to really know if you can do it, or not if you can do it, but if you want to do it. Because I feel like if you really want something, like you will be able to do it. Like you will do what's necessary to get it. So that's definitely my first advice. My second is that, I mean, in high school you're still young. Like you don't have to worry too much about getting experience, things like that. Like you can do that in college. But if you can get experience in high school, that's definitely going to give you, you know, a little bit of an upper hand, and just like you'll get exposed to it at an early stage, and it's only going to help you. So for example, what you're doing, Sean, like that's amazing. Like for high school students to find those internship experiences, like that's really cool. So if you can do that, like definitely do them, like definitely do them, especially because they expose you to the real world, and like you really get that firsthand experience, like real world experience of what the field is like. So that's something really important to do, because you can learn the theory, you can read the books, but it's not really until you do something that you realize that you like it. um so yeah, that's my second one. And third one, I mean, again, you're still in high school, but in college it's going to be really important to make connections. Like I think that's one of the most important things you can do during your undergrad. You know, a lot of people focus in having a good GPA and doing really well in your classes, which is good. Like I'm not saying fail your classes and not care, but what's more important than doing good in your classes is getting experience and making connections, because those are the things that will really help you get a job once you graduate. And you know, you never know who you could meet and who could open the next door for you. So that's really important. And the last advice, which I've mentioned before, is really, especially if you're young, like look at resources out there, like your vlog, like Sign Ninja, like the BME Life, and like all the other STEM accounts that are out there. Like I think they're all helpful, and they all share a little bit of, you know, their point of view of STEM, which I think is really important, because again, maybe the way that I talk about it doesn't, like someone doesn't really like it, but maybe someone will like the way that you are, Sean, and like the things that you're focusing in. So it's really important to just look around, see what you like, and yeah, I think just, you know, social media is a powerful tool right now, whether it's to just watch videos or connect with people. I think those are all important things to do.
Yeah, awesome. Those are some really amazing advice. Thank you so much for sharing them. And my last question is there anything you would like to add?
Let's see. I mean, I think, you know, again, just like everyone, remember that you can do anything that you want to do, that you're smart enough. It does take some work. Um, but yeah, I think, you know, that's pretty much it. Yeah, it was just really great to meet you. And it's really inspiring to see people. I mean, I see like so young, like I'm so young, I guess, but like you're in high school, you know, like it's so awesome that you're already doing this. Like I just can't imagine my high school self thinking of doing this. So I think it's great, and it's always really inspiring to see people like you in your generation doing things like this, because you know, the older people are always gonna look down on you. Like, you know, it's like, oh, these new generations like are so messed up. Like, and you know, like you know, it, I always felt like, oh, these generations are just like so crazy. But like just seeing people like you, I think is really comforting, and knowing that, you know, we're in good hands, and like there's amazing people coming, and that's just awesome.
Thank you so much. Yeah, and it was awesome talking to you. Like, I can't believe I get to talk with like someone that helped me, you know, discover BME, and it's definitely an amazing experience.